and they're like,
Never heard of sugar in the soil.
okay, so most of the time, the
Control your emotions, not break under pressure. All this
We are one of the very few businesses that was a
So many great tips already off the bat, and we're just starting.
to top box.
Hello and welcome to Healthier Habits, a podcast that discusses challenges and solutions when it comes to health and wellness, as well as connecting you to some local resources in Chicago. My name is Cassandra Zumba.
And I am Yakwache and will be your host. We are the Policy, System, and Environmental Coordinators here at the Chicago Partnership for Health Promotion, a program from the Office of Community Engagement and Neighborhood Health Partnerships at UIC. Our guest today is Miriam Virto, who has been part of Chicago Partnership for Health Promotion as a Nutrition Peer Educator for 15 years. She's currently the Cooking Matters Coordinator and has partnered with Veggie Rx program for 6 years. For Veggie Rx, she engages participants with healthy cooking demonstrations and nutrition lessons. In 2019, Miriam received the Robin Orr Spirit Award in recognition of her work in the community she serves. She has worked all over the city of Chicago in partnership with Chicago Public Schools, Chicago Park Districts, pantries, faith-based organizations. She's passionate about helping families feel empowered about their health. On her downtime, Miriam enjoys reading, Sudoku, and spending time with her sons and playing with her dog, Guate.
Thanks for being here with us. Well, 15 years, that's a long, thankful time, especially in one organization.
yeah, yes.
What can you say? 15 years. How has it been?
It's been great. I think time has flown by. I guess I've been having fun. It's been good. I still enjoy the work that I do.
What was your your path to starting in cphp or working with community, and how did you find your way there?
Okay, so I started at cphp. In the first 7 years that I was here, I worked with in Chicago Public Schools, and I worked with children, kindergarten, pre-K through high school, actually. I did that for the first 7 years. And then after that, I switched over. And since then, I've been working with adults in our communities, which I really enjoy. I really like the work that I'm doing. And then for the last 6 or 7 years, maybe a little more. So when I switched over actually to adults, working with adults, I became the Cooking Matters Coordinator. And so I've been, running that program. And then about 7 years ago, I started working with Veggierx. And then I became the Veggierx Coordinator, which I really like the Cooking Matters curriculum. And I really enjoy working with the Farm in Ogden for the Veggierx program.
Can you tell us a little bit more about Veggierx for the people who don't understand, that specific?
Yeah. I know it's been on the news, so I've run into a lot of people that actually recognize the program. But for those, that haven't heard about it, it is a collaboration between the Chicago Botanical Garden, cphp, and Windy City Harvest. Mm-hmm. What Farm in Ogden is an aquaponic farm right on the corner of Central Park in Ogden. So if anybody ever stops around there, they do tours on Saturdays. It's a really cool building. If you ever get a chance to go in there, check it out. They also have their grocery store, which is inside the building, and that's open Tuesdays through Saturdays from 11 to 5. So if you ever have a chance, check it out. It's a really cool building.
Yeah.
And then what was the question?
Veggierx.
Okay, yeah. So what it is, it's and so this is the Farm in Ogden is located in the North Lawndale community. So it's a partnership between North Lawndale community, North Lawndale Christian Health Center, and the physicians there prescribe fruits and vegetables to their patients. Mm-hmm. And then their patients come over to the Farm in Ogden, where they can pick up weekly a box of local fruits and vegetables. And the program runs from early February until mid-November. Mm-hmm. And then I'm usually at the farm on the days that the boxes are picked up by the participants. And then I do host a healthy cooking demo for the recipe that they receive that week with their box. Mm-hmm. So what we try to do is we try to match what's in the recipe with what some of the ingredients that they'll be receiving in their box. And it's just another way for us to show the participants just a different way to use the box in case they're, we all get tired of eating the same thing. So
Yeah.
if they're looking for like inspo, to make a different type of recipe. So that's what I'm there for. And we also do like healthy topics that we talk about. So it's pretty cool. I really enjoy it.
Yeah, I find that the participants really enjoy the like live demonstration,
Mm-hmm.
especially if it's not an ingredient that they're familiar with.
Yeah.
Because either you don't want any of this food to go to waste, or it's the fear of like, I don't know what that is, never mind, I'll get to the side. But if you have like a taste test, if you try it out, or you see that it's easier than what you think it is,
Yeah.
I see a lot more involvement and participation and purchasing and stuff like that. So
Yeah.
I know it's a lot of people seek, those live demonstrations.
Yeah.
So when it comes to healthy eating, can you give us a little bit of explanation? Because I feel like the Veggie Rx is to make sure people are eating healthy as well. So what would you say is healthy eating, and what would it entail? Because, I feel like most people, it's like, oh, I have to go based off my plate and I have to hit all this, and that. But is it like that, or what is healthy eating to you?
I think through my experience and my personal health journey, it's really hard to just look at the My Plate picture and kind of compartmentalize our food that way. So I try to talk to everyone, or tell everyone that I speak to, just, you want this to be the end of your day, that you completed all the food groups by the end of the day. Obviously, if you don't hit all of the food groups, like we just want more consistency than lack of consistency, right? And that should be kind of the goal. I think when it comes to healthy eating, I think we have a big fiber deficiency, and fiber is found in some of the foods that are just excellent for us, right? We're talking fruits, we're talking vegetables, whole grains, and we're also talking about legumes, like all types of beans. I've been on a lentil kick lately, and actually, promoting it is really easy. It's a difficult situation that a lot of people are seeing right now economically, with prices just being crazy at the supermarkets. But your bag of beans is still relatively the same price, and you can make like a billion beans out of one small package and eat for a long time, and you're eating something that's actually super delicious, right? One of the, not one of my favorite comparisons, but one of the easiest ones is the pack of ramen compared to the pack of beans, right? Like they're both pretty cheap, and you're going to get a lot of food from each of these packages, right? But you're definitely going to get a ton more nutrients and vitamins and minerals from the beans that you would from the package, the box of ramen. So it's just an investment in yourself. So just eating healthy is just, focusing on that. What are the foods that are going to give me more nutrients, right? And still kind of a bang for your buck. They're still relatively cheap.
Yeah, I like the comparison with the ramen and the bag of beans, because I hadn't seen it like that before, and I feel like that's another way that people can visualize it. I would let go of the ramen a while back, but at least the instant one, But that's very true. It's an investment in yourself. So if you're not taking care of yourself, how are you going to take care of other people as well?
Yeah. And I feel like some of the difficulties, like sometimes you can eat healthy at home, but then when you come to work, because like maybe you may not have the options as well. So then you're like, oh, let me just go get a snack from the vending machine, or let me go downstairs and grab like some fast food because you only have a 30-minute break, or like, you don't have inadequate time for breaks. So how do you support those employers that want to support their employees to eat healthy, to continue that healthy habit in your line of work?
Okay. So one of the partnerships that I wanted to highlight is Envision. And I actually visited their headquarters 2-3 weeks ago, and we had a cooking demonstration. They invited me to do a healthy cooking demonstration, and it was actually for all of their employees. Because this is like their all-day staff meeting, so everybody was there. And it was really nice to see just them literally take a break from their desks, come over, learn about this healthy recipe, try it, be excited about it. So what we're hoping to do moving forward is be there on their day when they have all their staff there, and do like a healthy cooking demonstration, and possibly do like a yoga session with them. Or maybe like a fitness session with them, just to kind of expose everyone to just different types of body movements, right? And just different types of recipes, right? Because I think I still hear a lot like healthy food doesn't taste good, right?
Yes.
And that's completely untrue, right?
Yeah.
And now I don't know if my mom's in it. We like growing up, I didn't like the vegetables my mom made, you know, but now I realize that she was trying to use vegetables that she herself had didn't grow up with, you know? So now that I can make them and, you know, there's all these recipes on the internet, like you know, like even the ones we have here, they're really good. And they taste a lot better, you know? So I really try to promote like it's healthy food can taste delicious, you know, it's delicious and it can be nutritious and you can feel good. And obviously that'll lead to looking great, you know? So I really like to talk to everyone about that. Another thing I want to mention is that sometimes just bringing in the aspect of money and how much money people can save, right? By eating healthier, you save immediately. Like you can cut down your grocery bill, $200, $100 immediately now, right? And then also saving in the long run what you won't have to spend on the diseases that you might prevent, right? So that's another focal point when I go out and speak to people.
Yeah, it's important to like break down people's misconceptions of what healthy eating is, what it tastes like, and how much it's going to cost. Because, you know, some people have the idea of like, oh, healthy eating means that I have to go to a grocery that is like 3-4 times more expensive than the one in my neighborhood. Well, you don't necessarily have to go there, right? Yeah. So there's other ways to do that. There's other local resources, or just like me personally, because that's how I've been taught. Couponing was always too. So if you have those resources, if you have that time, I mean, there's other little things you could do to engage in a more healthier lifestyle. And I think that's so great that there is an organization reaching out to you to teach to their employees, because we've talked about in other episodes that organizations themselves have a lot of influence and a lot of power on how their employees is to live their life. Not only because they're cashing their checks, right? But because if you provide better options, there's better choices to make.
And their productivity also goes up as well.
Right.
We all have the slump, but then if you're eating healthy, your energy's going up. I think I was at a community dinner with Dorothy yesterday. And Dorothy, one of the things a lot of the members were talking about is just like healthy eating costs a lot of money. But then you realize, like you were saying, you do save money in the long run. Because like, fast food, now at McDonald's, for example, fast food used to be like, $5? But now you need like $15 to have a full, like a,
I refuse to give them my money
chicken
anymore.
Or something. Yeah. So in the long run, you are still saving money. And also like with the conversation of healthy food does not taste good. Kale by itself, it is a questionable taste. But there's still
it's
different
superfood,
things.
but it's very bitter.
There's different things you can add to it that can bring the flavor out, or different recipes that you can use to make it. So I guess with your cooking demonstration, I know you mentioned you did it with kids and then you did it with adults. What is the difference with receptiveness when it comes with working with kids and then working with the adults and double?
Man, I just finished 4 culinary sessions with SBEV over on 54th and State. And it was 3rd and 4th graders, and then it was like 6th and 8th graders. And I did 4 sessions with them, and I just completely reminded of how much more receptive children are, you know, and how much more excited they were. And you know what, having my own children, it reminds me of how much they really want to help. Like children just really, truly want to have the best relationship they can with themselves, with you, with their food, you know. So they were really receptive. We made a whole grain pizza dough crust. We made turkey tacos, which were really well received. The pizza too. And then we made a flavorful stir fry. They were on the tofu. But you know what? I didn't press it. So that maybe might have been on me. And then they made a fruit salad. So I had them grating, carrots and beets. No, that's a lie. They were chopping cantaloupe and strawberries and blueberries. And they were really, really excited. They were really excited. And Cassandra over at SBEV, she said that it was like a really popular class, that they just like, they were really wanting to, it had a capacity, I couldn't have that many students. But they were really excited to want to be in the class. So I would say, children.
Children are.
Yeah.
It's more receptive.
I can relate to that because before I was here, I was working at an elementary school. I used to participate in the comment threads. I loved it. The kids loved it so much.
Yes.
The participation level, the going back. I'm going to show my mom this. I'm going to show my dad this. It was just wonderful, and they were ready. They were so excited to just try something new. And in the current work, and then we're just doing like different countries. So it's like, oh, where are we going today? So it's also just like transporting you to different places. So
Yeah.
working with kids and seeing just the joy they have in just finding new skills and
Yes.
learning how to be a little bit more independent, like at home, you can see that it's
Yeah.
the joy.
And they can do so much, and especially right now that, a lot of the children are home on summer break. There's quick, easy, healthy recipes that they can make. It doesn't have to be something unhealthy. It can be healthy and it can be quick. So I always put that out there. And it can be cheap. It doesn't have to break the bank. Right.
Yeah.
You got to eat right, you move, and then you're saving while at it too. And then we've talked about the cooking demos. We've talked about the Veggie Rx. Do you have any experience when it comes to healthy catering? Let's say an organization, I want to treat my employees to a great lunch. What would you suggest that an organization do instead of getting the fast pizza or getting, unhealthy food or food that wouldn't benefit their employees? What do you suggest organizations do or think about when they are trying to cater for a large group of people?
Well, I think the less, that's a big one, I think first it's really working the policy, right?
Yes.
Because if there's no policy, there can be a lot of pushback, or there can be just a lot of unhappy campers. But if you put a policy in place and gradual, nobody
Right.
likes big drastic change.
Yeah.
Let's do it gradual. I think the best example I have was actually our own policy change that happened here at cphp. And it was brought about by one of the dietitians. And so it just stated that whatever food was going to be purchased by the university, that it should be, it should meet certain criteria, right?
Mhm.
Honestly, ever since that policy got put in place, I don't know, it's been years. Okay?
Right.
Been here a long time. I can't remember ever being at a company function and being like, man, the food was nasty. Like the food has been legit. It's been tasty.
Yeah.
So I don't have, a big issue with it. I think it can be done. I think it can be done in different measures, and small steps. But I think promoting wellness has, especially within a company, it's got to come from the top, and it's got to come from a personal change, and it's got to come with a lot of grace and very gentle, and a lot of room for people to speak on how they feel. Because, food is so personal. So there's a personal relationship of people with food.
Yeah.
And then culturally, what are we used to when we're at a social function? What are you used to at a social function? It can vary, obviously, between people. So I think just, approaching it with a lot of respect towards your employees, right? And just remembering that we're all human, and we're all struggling, and it gets difficult, it gets hard. And then sometimes work is where you go kind of to get away, and so you want it to be comforting, right? And that might be comfort food. So just being really respectful and very gentle and very open to suggestions from your employees, right? So I think CPHP does wonderful with that.
Yeah.
Honestly, I've enjoyed all of the food.
Yeah. There has to be a moment for like structure, of course, but there's also has to be a room for mistakes, right? Because not everyone is going to be able to go line by line, roll by roll, and just keep going. Because it's dieting, or not even dieting, because I don't like that word either. But just having a different style of eating is very difficult for each person, so just because you do it great one week doesn't mean the next week is going to be the same, because again, life happens. There's other things that are around you that don't necessarily help you out in that case. But if that's one less thing you have to think about at work, and they're taking care of that healthy aspect, then again, you have a healthier choice that you don't even have to consciously make.
Yeah.
It's just the options that are given to you.
Right.
But again, having grace, some people have different preferences. So if they decide to bring their whatever extra on their own, that's on their end, right? As a company, as an organization, making sure that we provide as much good option, healthy option as we can, and then having just that room for like, okay, well, you can adjust on your end, but as a company, this is what we're providing.
Right. Yeah.
And I'm glad you brought up policy, because we are going to, in a previous episode or in an upcoming episode, we're going to talk about wellness policy. And so stay tuned for that for the audience. And it's a great thing because like when you have a policy in place, it's hard to deviate from that because it's a system that you create for your employees as well. So now, for the employer and then for the employee, what are tips for them if I wanted to start coming to the office and participate in healthy eating? What are tips for me as an employee that wants to engage in that or start a healthy eating habit?
I feel like it starts with prep. Like you have to be prepared if you're going to make the easy choice a healthy choice, right?
Mm-hmm.
You got to be prepared. And a lot of people, I feel, and I myself used to get scared when I hear like it would put me back a little. You got to be prepared, because it sounds so official. But being organized and being learning how to use your time better, like it's not. Even if it's something that you didn't grow up being, like you can work on that.
Yeah.
It's something that you can change. Yeah. So I would just suggest following on social media just a lot of healthier, accounts, or following people that are trying to get to the same goal that you are.
Mm-hmm.
I think social media plays a big role in it. What you're flooding your social media with.
Good and bad.
Yeah. Hopefully we're gearing towards the good. But definitely letting maybe family members know, somebody that can help you be accountable, not in a mean way. It's going to help you be accountable in a nice way. And then just finding one or two coworkers to, kick it with you on your healthy journey. Somebody who's going to want to take that walk with you. Right? Somebody who maybe can help share a lunch with you, right? Like you bring this, I'll bring this, and we're picking healthier options. But definitely being prepared, I think is and it doesn't have to be like expensive, like breakfast can be a piece of toast with either avocado or yogurt, it doesn't have to be this 5-course lunch, right?
Yeah.
It can be something small and it can be easy. Start where you already are.
Okay.
I guess that would it be. Begin where you're already at, right? And then don't try to take anything out. Just add a little more veggies.
Yeah.
Add a little more veggies, add a little more water, and then move on from there. Yeah.
I'm glad you said that, finding family members or finding someone with a similar goal, because sometimes when it comes to try to change a habit, if you're not in the same space as those with the same goal, they may make a comment that might just throw you off.
Mm-hmm.
I don't know. I have an experience with, with friends where you're eating a salad. Oh, you're eating a salad.
That's the worst.
They make a condescending kind of comment. And sometimes you start feeling self-conscious. But then if you have those that are around you with a similar goal, then it's encouraging that you have someone to at least support you in what you're trying to achieve as well.
Yeah, comments in general, it's like, let's put it out, Obviously, you're trying something new, just let it happen, sometimes it can deter you, and maybe that's a long final straw for some people. They're like, okay, never mind, I don't want to do this. Like, people are paying attention. But, like, having a partner to do it with you is very helpful. Just, like you said, it just feels more comforting. I don't know, just having somebody else there to help you out, or just keeping you accountable, like you said. Maybe you didn't do great today, but okay, tomorrow we're on it, right? We're gonna do this.
Yeah. And if it's that partner that's like, oh, forget about it, let's just go do this. You need a new one. You need a different one. You still love that one, but
that did happen to me in high school. We did. My friend and I got a gym membership. I think we went twice in the full year that we paid because we were both like,
maybe tomorrow.
We'll go across the street and get in the latte and then hit that place again.
Me with my Planet Fitness membership that I haven't been to in 2 years.
I mean, I do all of my working out. I have 4 kids. I work full time. I'm in school full time. So all my workouts happen at 5 a.m. at home, in my bedroom. Like that's what I do. There's a lot of YouTube videos that, that's another thing, right? There's a lot of free YouTube videos, so many free YouTube videos. And there's anything. I mean, you can do walking a mile in 30 minutes. You can do walking 3 miles in 30 minutes. You can do, dancing. You can do, there's like, workouts with no jumping. There's, in case you live in an apartment and you want to make a noise, it might, in my instance, I want to wake up the kids before it's time for them to be up, So there's just a million free workouts that you can access, And so it doesn't necessarily have to be a gym membership, but some people like to go, right? Some people like to go, they want to get out of the house, and that's completely fair too.
Yeah. It's adjusting to your own needs. So whatever fits one person doesn't necessarily mean it's going to fit you. You're going to have to do the trial and error thing and see what little pieces fit for your own schedule too. Like you said, you work out at home because it's convenient for you and your family. Yeah. I work out at home because I just feel like it's too overwhelming to have everyone else that knows what they're doing. And I'm here like, pretending like it.
It can be so intimidating, right?
Yeah.
So thank you for the tips for the people. And I know you mentioned having a wellness policy in place for the managers, but let's say they're not there yet. What could be some tips for them to promote or support healthy eatings for their employees?
Man, those vending machines with the candy bars, they gotta go. I would say just start with looking for a program like ours, that can come in and, if management can't do it themselves, to start promoting healthy initiatives, then, come out and just look for an organization that could come in and speak to them. Possibly engage them in a cooking demonstration, maybe bring in, I love what cphp does. Our annual retreats are always at different places, which has helped expose us to different fun things really to do within the city of Chicago, and most of them are affordable, right? They're not like super expensive. So just, doing something like that, bringing in maybe an organization that can help talk to your employees about healthy eating,
I've heard of people do like lunch and learns, which is a great way. I know you were talking about how with the produce box they get for the Veggie Rx, you still teach them, hey, this is how you're supposed to cook with this. So lunch and learn would be a great opportunity for employers to support their employees as well. So I guess we can ask, what are your favorite partnerships? And then what are the recommended partnerships for those organizations that you've worked with so far in your 15 years?
I've had so many favorite partnerships. I've, shout out to Young Men Elementary, Peck Elementary, STEM High School has been a favorite. The PCC clinics at the clinics that I work with now with Veggie Rx are excellent too. I really enjoy them. But I guess right now my most constant and truly one of my favorites has been working with Windy City Harvest for the Veggie Rx program. It has helped me personally on my health journey so much. I've learned so much. I've worked with so many different people, so many caring dietitians. I've met a fabulous nurse named Nancy Rodriguez. Shout out to her, who is just completely changed my view of what can be done with some of these chronic diseases. I mean, she is really helping people one person at a time, but I mean, big drastic changes from, almost being blind because of diabetes to actually being able to see. I mean, it's just in all using plants, all using vegetables. So it's just been very invigorating to be with Veggie Rx and Windy City Harvest. They're also like super kind, like all of the people at the farm that I've worked with. I've in 8+ years, I've never seen them be cross or, any participant that comes in is made to feel welcome, is made to feel like you are at the right place at the right time. This is the place for you. We've had a lot of people that have come in very sick, newly diagnosed with these chronic diseases who you can tell are just really afraid and no place to go, right? But they had somewhere to go. They had the farm to come to. So that's really really comforting for me to be able to help our communities this way.
And it's so nice to hear stories like this of the way you or other organizations go into the community, see the changes and see like the positive things that happen. I mean, that's kind of why we're also doing this podcast, so we can highlight other organizations and their work, but also to demonstrate a little bit about what we do within cphp, what you're doing within cphp, all the little bits and pieces that come together to just try to improve like the community, the city, healthy like initiatives that we have. So thank you so much for being here.
Oh, thank you for inviting me.
Appreciate it.
Before we end, I do have one quick question though. For the audience listening, for me too, myself, what is the process to get into the Veggie Rx program? I don't know whether we talked about that. If I was very interested in the Veggie Rx program, how would I get involved?
So I know there's different ones all over the city, but you know, the one that I work with is with Windy City Harvest. I believe that right now it is only for North Lawndale Christian Health Center patients.
Okay.
But they've partnered with PCC clinics. So I think the PCC patients too. I know definitely the PCC patients at Salud, which is on the north side, and then the PCC clinic in the Austin neighborhood. They have their Veggie Rx program too, but I think for those two specific clinics, it is for their diabetic patients.
Okay.
Yeah. And I think for North Lawndale, it's open to all of their patients, but exclusively for the patients of North Lawndale Christian Health Center. But now if somebody's looking to start up their own Veggie Rx program, you know, if they have an interest to, they could reach out to the veggierx manager, Qatar James, over at the farm on Ogden. She is a great, fantastic resource. She's a great person. She's a fantastic resource on how you could go about beginning your own veggierx program.
That's great. And how can people reach out to you if they want to maybe do a cooking thing with you? If you want to start any kind of program or any kind of information, they might want to reach out if you'd like to share.
Yeah, they can reach out to my email, which is mvirto@uic.edu. Feel free to reach out.
Thanks for listening to Healthier Habits with your host, Cassandra Zumba
And Diakwachi.
We hope you enjoyed this conversation. Keep an eye out for more episodes and make sure to subscribe and hit the notification bell.
Here at cphp, we have the eatmovesave meal kit. This is an e-commerce project dedicated to improving and resolving access to healthy and affordable foods through a meal kit, which is packaged and delivered directly to a family's home throughout Chicago through Typebox. Visit our eatmovesave website for more information on meal kit ordering and delivery.
You can help support the podcast by liking, sharing, and subscribing, following us on our social media accounts on Instagram as eatmovesave Chicago, Facebook eatmovesave Chicago, and YouTube as UIC OCEAN-HP. Look for the podcast tab for more episodes.
If you'd like more information on partnering with our organization, head over to our website, cphp.uic.edu, and send us a message.
Thank you for joining this chat. Check out our links and resources in the description. See you next time.
Bye. This institution is an equal opportunity provider. This material is funded by the USDA Supplemental Nutrition Assistance Program, SNAP. Chicago Partnership for Health Promotion is a unit of the Office of Community Engagement and Neighborhood Health Partnerships, representing a network of community-based interventions designed to improve nutrition and reduce disparities in outcomes associated with nutritional diseases, including obesity. CPHP provides high-quality, age, gender, and culturally tailored nutrition education in various venues across the city.
Eat, Move, Save.